When we first came on board with HST, and with our background in Medicare, we had some growing pains to go through. And I can tell you that bringing Sherry on board and what Sherry has done in a very short period of time is invaluable to this organization. And if you are not taking advantage of what she brings to the table, shame on you. What she did with this relationship with JSA. Now, I know a lot of you guys may be directly appointed or with carriers out there, or you're with a different FMO. I can tell you this, that I am fortunate. I live in South Florida, as I mentioned. I have a JSA regional office about 3 miles from my home. And so Karen and I set up an appointment to go speak with our representative, and she took all the time that we wanted one afternoon to go through their organization and what exactly that they do for us and for us. And this is something that I found so unique. I've been in the space now I've been in the insurance business for 33 years. I have never seen an FMO that operates under these guys. They are a complete support organization. They don't compete with me. They're not in conflict with what I do. They are just nothing but an organization that completely is dedicated to the senior market, the senior plans, and from an agent standpoint, a complete support system that you cannot get from anybody else. Again, it has just been a major league home run for us. And so as Karen was identifying, you talk about marketing support, you talk about lead availabilities and so forth and so on. It's quoting tools. I mean, applications online, education, things, she mentioned that we do the constant contact and that kind of stuff. They give you the content that you can take out and put it in there already, so you're not spending a whole lot of time with that. So just a wonderful resource.
Before, it was a process of having to go to each different carrier. Now it's streamlined, it's simplified. You can go in, see all the different PDPs, prescription drug plans, all the different supplements, all the different Medicare Advantage plans, the enrollment process, also the resources that were in there to work on marketing.
When I came on, there was no quoting tool that I could use to filter out what was available in an area for a client. Now with our partnership with JSA, there's a lot more tools that are really handy to use and make the process, especially the research portion of meeting with the client, a lot quicker.
When I started with HST, they didn't do anything with Medicare, so I had to go outside of HST to find any access to any sort of support. I had to sign on with an FMO that I didn't know much about, and came to find out later on that that they didn't know as much as I had hoped, and so I wasn't getting a lot of great support there. So what's changed? Everything. Everything. HST got into Medicare, and I, over the years I've done Medicare business with HST, and I've done Medicare business outside of HST. But I think now things are changing in a positive direction with the support, the commissions, the contracting. Everything is becoming much more streamlined. And that's a good thing for new people coming in and those of us who are, redoing things. I love selling Medicare because I love dealing with the senior populations. So people going into Medicare are making major changes in the way that they access their health care. It's confusing. It's full of landmines and pitfalls, and so they need somebody who really understands what's happening and can help guide them through it. They are the nicest people that you could ever know. They'll take your phone calls, they look for advice, they take your advice, and then they tell everybody they know about you and how wonderful you are, and you get so many referrals.
Are the easiest and most fun clients to have. They come to you, they really want your help, they want to listen to your guidance that you give them. Most of the time they'll always stay on your books. They're happy to work with you, and you can really create a true and honest relationship that lasts for years to come.
This is my third AEP in the Medicare space, and after watching Joe for 10 years of selling Medicare, and every day he'd come home and he's so excited because he met such great people. And so I thought, you know, I want to be part of that.
What makes this business so much fun is when you start to become part of their lives like this. And nobody likes to talk about their healthcare like people in this over 65 market, okay? Half of my business is referrals, and it's not something that I put out there. It just came automatically. Medicare for me has been the stabilizer in my overall book of business. Didn't know that at first. It was only probably after the third, fourth year involved, especially in the Medicare Advantage space, that when you start to look at my time invested in it, the relationships, income, you know, you kind of wish you had been involved with this years and years beforehand. You know, there's a lot of headaches in our business when you look at the under 65 market, whether it's group or individual. You know, this didn't get paid, this didn't get blah, 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 that kind of stuff. In Medicare, I enroll somebody in a Medicare plan, whether it's a supplement or Medicare Advantage, boom, it's done, okay? There's not a lot of service work. There's really no headaches. The only headaches in this business is the headaches that you create. But from an underwriting standpoint, a placement standpoint, a claim standpoint, it's done.
I've been doing this 8 years, and I've accumulated a lot of clients. So my process is about managing my own client base and making sure that the clients I actually have are taken care of. So if they need to make changes during AEP, which of course many of them do, it's really all about connecting with them, giving them a streamlined and simple process so that they can make the changes that they need to make. So I don't do a lot of accumulating of new clients during AEP. It really is about managing existing clients, and of course their referrals, because once you do have a Medicare client, you wind up taking care of their family members and their neighbors and their people at their church and whatever. So so really for me, it's all about just managing, the people that I already know.
We do a constant contact with all of our current clients. So yesterday I was able to send out an email to all of our current Medicare customers and to let them know it's that time of year again. Plans change. We've got enhanced benefits. Please schedule a call or a visit or a virtual meeting, and we've been more happy to go over with them what changes are coming in 2021. So we do that within 10 minutes of sending out that constant contact email. Joe had like 10, 12 calls, another 12 appointments set. I also do a mailing to those of our clients that don't have email addresses, so they get the same annual notice of change letter. JSA, what a great organization to help you with your marketing.
Thank you, Sherry Miller.
Yes, thank you, Sherry. I went into the prospect list. I typed in certain zip codes. I went into their marketing tools and printed out some personalized postcards. So I was able to take my zip codes, get my postcards together, and sent out a mailing of 1,200 postcards yesterday.
A couple of things I wanted to talk about, sort of best practices. I would advise don't take any shortcuts on compliance. There's a lot of different things that we have to be careful of, and don't shortcut it. Just really do what you need to do. so that you're giving compliant presentations, you're collecting your scopes, all of those things that you have to do them. You don't want to, get into this and then get shut down because you're doing something wrong. Make sure your clients understand the nuances of the product that you're enrolling them in. So make sure they understand if you're putting them in a prescription drug plan, the difference between preferred and standard pharmacies. That comes back to bite you later on, and inevitably they don't always understand it, and you'll get calls. But do explain very carefully the nuances of whatever it is you're enrolling them in. And then I do a cheat sheet at the beginning of every season because, I can't possibly remember everything about all of the different products. And so I'll have a PDP and an MAPD cheat sheet that I can just pull up and look at for the states that I work in. And that really helps in the beginning to kind of cement, what all of those attributes are when you're talking to people.
Look, it's not just an open enrollment period, it's 12 months of the year. For the new people that are looking at this and only knowing what you've been introduced to so far, I can tell you this, that as a pillar in your overall book of business, it's essential. You're looking at 8,000 to 10,000 people a day in this country turning 65. This is a phenomenal number. It is a fantastic market. It's easy. It's comparatively to what you go through on a daily basis with underwriting and claims and all the other facets of the U65 space. Medicare is pretty simple, whether it's Medicare Advantage, Medicare supplements, prescription drugs, and then a host of other ancillary products, just like you do now. When you're looking at your ratios of whether it's 2 to 1, 3 to 1, 4 to 1, you can do the same thing in Medicare. And so if you're just looking at a Medicare Advantage or a Medicare supplement and you're looking at commissions there versus the commissions that you can make in the, the short-term space and so forth and so on, I think you need to put some things on a spreadsheet and take a peek at it, because people are looking for final expenses. People are looking for hospital indemnity plans. They're looking for a host of other programs to complement what they're doing. So income, it's a no-brainer.
If you're even new and it's your first AEP, don't worry, just keep working through it. And little by little, you're going to keep accumulating those clients, and those clients are going to turn into referrals, because the seniors, they love to talk to one another and tell them about the great experiences they've had.
Definitely stay prepared, stay focused, organize your time well. Don't get caught up in situations where you're not prepared or that you haven't done your homework prior to a meeting with the beneficiary. For something I wish I knew the first go around, how to navigate through the different carriers and make sure that I had everything organized, especially when it came to prescription drug plans and advantage plans.
Always market. Continue to market 12 months out of the year. So what I mean by that is it could be digital, the Facebooks of the world. It can be in print if you got a local newspaper or publication. The seniors are more apt to look at print media than digital. Market with your local pharmacists, your doctor. If you have your own personal primary care doctor or specialist that you see, make sure they know what you do. Those can be the greatest referral sources, for people coming your way. As far as, the sales process, try to set hard appointments. Get them set up in your calendar, scheduled. Send them the reminder a day or two before so they know that they have the appointment coming up. If you can send them prior to the appointment some of the forms that you're going to want to collect as far as information, maybe their doctors they use or the prescriptions they take, the scope of appointment. If they can get that filled out prior to the appointment, it helps streamline your process and you can be well prepared for your appointment.
When I started 8 years ago, there weren't, or at least I didn't know of a lot of resources for help. People now who are starting out now, particularly at HST, have so many resources available to them. not only at HST, but, carrier resources. I wish I would have had access to all of those things, way back when I started. But advice to people, take advantage of all of those carrier trainings and rollouts. Listen to the experts talking about what they know. When you go to an Aetna rollout, you're going to get everything you could possibly need to know about Aetna. So take advantage of those. Now they're all virtual. There's Zoom meetings. They're doing parking lot pickups for kits and stuff. But take advantage of those carriers. Get to know your broker managers. They are the people you're going to go to, besides Sherry, of course. They're the people you're going to go to when you have a question or you're stumped on something. So if you're brand new in Medicare, that's going to happen a lot. And they are a great resource, a source for help. I would also recommend getting to know a handful of products so that you kind of have your go-to ones you really know and understand. So when you're talking to people, you can kind of segment them pretty quickly and easily. Even though you may have go-to products that you really love, have a wide array so that you're not trying to fit everybody into, what works for you. You want to do what's best for the client always, and that means representing enough products that they can have a reasonable choice. And if you don't have a product that really works for them, then make sure that you know somebody that you can refer them to and get them into, the best product for them.
All the support and resources that HST is now providing, especially after the partnership with the JSA. There is a direct communication path. A lot of great things there, just from Sherry constantly being in contact with all the different agents, and certainly the ramp up in the training from the basics of Medicare all the way through the different availability and options that are out there for us. So we're really excited for this year.
Yeah, I think it's going to be super busy. We're really prepared. We have a lot more experience under our belt, and I'm just excited to write a bunch new policies and get people on my book and really kind of evolve ourselves, not only in the local market, but certainly expanding a little bit broader as well.
When I look back just 5 short years and I look at the products that I was marketing then versus the products that I'm going to market in 2021, specifically, for example, the Medicare Advantage, it's apparent to me that with the growth that's going into the Medicare space, these plans are getting richer and richer and richer. And the winners from this is obviously our clients. Aetna came into my market. They were here, but they really weren't here. In other words, they filed their products, but they weren't competitive. Last 2 years, they've been extremely competitive in our marketplace. And now I've got, there's a number of carriers out there, but what I call the big three, because these guys, United Healthcare, Humana, and Aetna, dominate the space in South Florida as far as I'm concerned. And so when I'm able to sit down and go through the ANOC, annual notice of change, along with the additional benefits that are being encapsulated into these plans, and to see the reactions from my clients, again, it's a win situation.
Oh, I think top of the list is the advancements in technology. Not only through the carriers, but the CMS and all of the compliance pieces that we have to deal with. Those are becoming easier to manage, and that's really, really exciting. And I think the products are getting better, especially in the MA space. It was about three years ago, maybe, Aetna came out with their zero premium PPO. And that was groundbreaking. And now all of the carriers are coming out with those products. And it just means better choice for the clients and products we can put them in that, that we're happy with. It's not the best, worst choice anymore. It is really about really great choices.